Hello everybody, my name is Heather Noriega, and today I will be talking about the difference in the United States healthcare and the Honduras healthcare. So let's go ahead and start off by talking about the United States. We are mainly geared towards private insurance, meaning that individuals have to find their own insurance and pay for it monthly. Some employers also offer insurance to full-time employees and usually pay for a portion or all of it, which is nice. However, in the recent years, many individuals went without insurance, and that was when the Affordable Care Act was implemented. It is now required to have insurance, and this was set in place to try and lower the rate of the uninsured, which it did successfully do, but now we have incredibly high premiums, which causes all the low-income families to struggle with health care. And Honduras, on the other hand, is still fighting the battle of being uninsured. Most individuals get their insurance through private companies or through the Honduran Social Security Institute, although the co-payments and premiums for them are much lower than here in the United States. The National Health Expenditure Survey showed that no more than 10% of the population in Honduras is actually covered. Population health, I will be talking about the infant mortality rate. Infant mortality is when the child does not live past the age of 1 due to different attributes. And here in the United States, we're actually considered to be an embarrassment because according to the Washington Post, our national average is 610 deaths per 100,000. I also put a graph to show it as well, that we're all the way at the bottom. We have the highest infant mortality rate compared to the other wealthy 27 countries, and we have been declining over the years, but we still need to work on it, especially because there's higher ranges depending on what type of ethnicity you are here in the U.S. But in comparison, Honduras, being a high-poverty country, has a higher mortality rate. According to the Center of Disease Control and Prevention, the infant mortality rate in Honduras is 1,700 infant deaths per 100,000, which is basically triple the rate of what we have. During the last decade, though, they have worked on their healthcare systems to improve it, and most of the population is below the poverty line, which is why the infant mortality rate is so high. Most of them don't have the efficient care that they need for that in particular healthcare. Out-of-pocket healthcare spending is another concern. Here in the U.S., a medium-income family of 4 with employee-based insurance saw an annual income increase, but then they also saw the amount that they were paying for healthcare had also risen. On average, for the family of 4, costs range from $135 to $235 a month, which is like a 78% increase from just like a decade ago. In Honduras, according to the Pan American Health Organization, the public expenditure accounts for 32.9% of the health care expenditure, and with that, 53.7% of it is family out-of-pocket costs. So although I don't have a cost range, the percentage is lower because most are below the poverty line, and if they go to the doctor, most of the time they're unable to pay the co-payment of $5 to $10, and if they aren't able to, then normally it's just waived, which is nice for them. In the U.S. healthcare system, it is very important to support breastfeeding. According to the Journal of Clinical Nursing, breastfeeding is an effective way to promote infant health. Breastfeeding should be implemented when the baby is first born, so it should start in the hospital, which makes sense. Honduras is also supportive of breastfeeding. It's just there's a difference because most of the women that come in there, since they're below the poverty line, have a low body mass index, so it makes it hard for them to properly lactate due to their diet. According to the study for the Journal of Nutrition, if the hospitals were able to help the mother maintain a healthy diet, they're more able to breastfeed longer or altogether. So in return, this helps the infants with low birth weight, as well as normal birth weight babies. Public and health prevention. Children aged 19 to 35 months here in the U.S. have received all of their recommended vaccines is at a 90%. It is important for our children to be vaccinated in order to help fight off certain diseases, And although the World Health Organization wants it to be 100%, it's still higher than other countries. But what was surprising to me is that Honduras has over 90% of children vaccinated for the major vaccine preventable diseases. They start off at 2 months and continue the vaccines which are provided to them, and they've actually made a lot of leeway. They've gotten rid of polio virus, they've eliminated measles and rubella, and they also have control of the other listed, diseases on here. So they've actually have done an outstanding achievement over the past, 15 years. Physical environment for safe drinking water. The Safe Drinking Water Act of 1974 required the administrator of the Environmental Protection Agency to arrange a study, and they also had to make sure that the water was clean enough for us to drink here in the U.S. Although some states vary within the clarity of their water, it still has to be able to be drank. And from the study, they did declare here in the U.S. our water drinkable with the proper purifying techniques. However, though, for Honduras, they do have access to water through designated areas, but the way that they store it actually causes E. coli. So according to the American Journal of Tropical Medicine and Hygiene, the study went to different houses and looked at the tanks that they were storing in, which they ranged from like cement to plastic, and all of them E. coli was present. And then they also found that most families boil the water to kill the contaminants, but then when they go to clean all of their cups and bowls, they use already used water, or they pull water directly from the tanks, which kind of defeats the purpose. And then they also pulled water from the tanks to bathe, which causes poor hygiene and poor health. Access to health. In the U.S., according to the CDC, 28.2 million adults aged 18 to 64 were uninsured. This makes it about 10.4% people with no insurance, and most were actually elderly due to financial situations. And although the ACA was implemented, it still made it hard for people to afford the premiums, and ones who are insured were also penalized at the end of the year during tax season. And then compared with Honduras, where 90% of the population is uninsured, there are only 520,000 people who actually have insurance, and most of them live in the capital or larger areas. And most of them, are below the poverty line and therefore unable to afford insurance, co-payments, hospital visits, and surgeries. Social and economical environment. Poverty has increased over the past 35 years, and it varies between percentages between the states. The factors for these are decreased wages, income transfer programs like welfare support has decreased, and there has been an increase of numbers of single parent and female-headed families. So 20% of welfare actually goes to the families that are struggling, and then the other 80% is for the elderly, so it makes it a really tight situation for the children and adults in poverty to gain funded help, which in turn this can actually cause behavioral and mental issues for the children as they grow up. And for Honduras, according to the International Journal of Health Services, out of the 90% of uninsured, 66% are under the poverty line. It's normally due to job losses, decrease in remittances from family members out of the country, and being chronically ill, so they're unable to work. This does affect the children in the household. It can affect their education, behavioral and mental stability, as well as their own health. And my key takeaways. In conclusion, Honduras is on its way to improving the healthcare system in their country, but still have much to work on. The uninsured rate is incredibly high and needs to be reconciled as soon as it can be. With this, if the health of the people become better, then they would be able to go to work, and once they can work, they can get out of being below the poverty line. Education about their water should be implemented to correct the E. coli infested water. to have it properly purified. And then I think they also need help with healthy food living and, ways of taking care of themselves to have a proper food and diet. So these are all my references. And I hope you enjoyed. Thank you. Take care.